Well, hello, everybody. Larry Wilson here from SafeStart. Thank you all very much for attending. I think we have over 500 people registered for this webinar. Just before I introduce the panelists, for those of you who are just joining us, let me just sort of give you a bit of the background and history. It sort of started, I was at a conference in Berlin at the end of January, and we were listening to different speakers. And at the end of the day, I was talking to a senior vice president of a global company. Ed's fairly familiar with this gentleman. And we were just sort of talking about one of the previous speakers. And I said that I didn't agree with what he was saying about 24/7 safety being a waste of time. And the gentleman's name was Michael Cook, and he just looked at me and he said, "Larry, he doesn't have to live with it." And I thought, exactly. I mean, it's very easy for academics or philosophers to give advice or to comment on today's topic, which is zero harm. And I've heard many academics actually disclaim the value of this. I've heard some of them exclaim the value of it, but again, none of them actually have to live with it. Whereas the people we've had on the panel here, ladies and gentlemen, are the people who actually do have to live with these decisions and can at least give us some of the background in terms of how some of those decisions were made. So the first webinar that we did in this series was on complacency and COVID. It's not over till it's over, and it's still not over yet. So we're going to have a brief update from everybody just on COVID before we get going with zero harm. The next webinar we did, the last one we did 3 weeks ago, was on leading indicators, and it was very interesting. We all agreed that good leading indicators, as long as the quality and the quantity wasn't deteriorating. In other words, the observations or the inspections weren't getting kind of fudged, or the audits weren't getting pumped up, without actually being, the stuff being there, the criteria being there. But as long as the quality was there, we all had seen examples of where, as everything was going up, if you will, the tide going up, all of the injuries and incidents were coming down, and that seemed to be very reliable, and we all had lots of examples. A bit curious that with all of the expert panel webinars, and that includes India, Asia, the Middle East, and Europe, so far we don't have any examples of anybody that could tell us we're walking into a boardroom or an executive office with spreadsheets and graphs actually got the company to make a significant change before something really bad happened. But that's, it's only been whatever, 12, 15 companies, but we've all worked at more than one place, usually two. So that was very interesting. We'll see what happens as we go further with that, and whether I get more examples from people via email or via the website, whatever. But today's topic is almost the one that started the whole series, which is zero harm, yes or no. And we've had lots, like I said, lots of comments, lots of conferences over the years on the value of this, or whether it's a very inefficient statement or goal. But let me, if I can, just briefly introduce everybody. I'm not sure where they would be located on your screen. On my screen at the lower left-hand side is Anthony Panepinto from Procter & Gamble. I should probably say Dr. Anthony Panepinto. Anthony is he's an expert in epidemics and pandemics, everybody. He's also got a PhD in law, and he's also really funny. So, I don't know how you get all of that in one person, but we usually start the webinars off with Anthony giving us just a little bit of an update on COVID from sort of a Cincinnati, America, and then global perspective. Upper left-hand corner on my screen is David Bianco from Epiroc, And David and I've known each other for a long time, worked together for a long time. And like Anthony, one of the people whose opinions I value very highly. And bottom right-hand corner on my screen is Ed Stevens from ABB. And Ed is with the Global Training Department. He's been with the Global EH&S Department. And again, you know, some great comments and some valuable insights from Ed. And he lives in Florida, so it's always an interesting COVID update from Ed there. But Anthony, your hometown actually made it into the news up here in Canada. I don't remember. All I heard was sort of the violence in Cincinnati. I don't know what it was all related to, but you know, rarely is Cincinnati in the news about anything like that. But how is sort of COVID being treated in the Cincinnati area? How are you guys doing in North America at P&G, and maybe just a bit globally, Anthony, and anything else you want to share too? You've always got such great technical information as well for all of us. You were talking earlier too about some of the contact tracing and the armband things you guys were doing. So just whatever, Anthony, give us an update since the last 3 weeks.
Okay, let me start out locally here in Cincinnati. So yes, it was a rough weekend for violence in the streets. Unfortunately, a rash of shootings overnight in 4 neighborhoods in Cincinnati. So we made the national news. But relative to COVID, you know, things have kind of flattened out here after the last peak. And you know, as I've talked in earlier webinars, you tend to see 3 patterns. So you see a pattern where a virus comes, you think it's gone, and then you get the second wave during the next flu season. We may see that, we may not. Then you had SARS-1 back in '93, which sort of burned itself out. And then you've got this pattern of kind of wavy ups and downs that are driven by a number of things on a local level. And we tend to refer to that in the epidemiology world as a slow burn. And so I think we can sufficiently say that in most of the world, we've seen this thing sort of take that pattern of some high waves, some low waves. And, you know, probably one of the things as I look at the data most recently around the United States and around the world, if you start to look at really patterns of mobility, so there's a great brief article published a few days ago around where they looked at cell phone signals on the Strip in Las Vegas. And they realized that the bulk majority of those cell phone signals that they found on the Strip in Las Vegas, after 4 days, dispersed to every state in the United States except for Maine. So it talks about the mobility of people and how you know, few people get infected from being in a congregate type of situation, whether it's a casino, a restaurant, whatever. The mobility is so high, it's very easily spread out, and this is a huge travel season. So a lot of people are calling me, asking me about safe travel. They're calling me asking, of course, about what I think about going back to school and those sorts of things. On a global scale, the thing that I continue to tell people, it isn't over just yet. And you know, we had a facility in Europe based on local country norms and city norms, decided to de-escalate. And fortunately, we didn't see any harm from this, but the city ramped back up very quickly in the cases, and we had to re-escalate. And my only caution there is everybody wants to de-escalate, go to the old normal, and I'm not sure the old normal is really the old normal until we have sufficient, you know, pharmacologic treatments to reduce those people that are most ill, the impact, or a vaccine. But we should be able to control the spread of this. And just one thing relevant, and I don't want to steal any of Ed's thunder here, but I've been looking at the data for the southern states where you have these swings. And one most important thing to note is that not only are we seeing cases and the age of cases shift toward the younger realm, you know, 20 to 40, we're also seeing hospitalization shift in those states from what traditionally we thought were highly susceptible people over the age of 55, in fact, over the age of 75. Now we're seeing hospitalizations of 20-somethings, 30-somethings, early 40-somethings, and that's alarming because I think that could be characterized and traced back to level of exposure. So that's just a quick rundown, and just to talk about what Larry brought up. We're testing a number of contact tracing applications on phones. We're testing some bands. Still kind of in the early days, but I think wearable technology holds promise on a lot of fronts. But what we're seeing right now is good acceptability from people wearing it. In fact, people like kind of that reminder of social distancing. So we've gotten pretty favorable feedback. The pilots still have a few weeks to go before we make a commitment on what technology I think we'll settle into. But so far, so good. So that's your update on COVID from Cincinnati.
Well, I was thinking about you last night, Anthony. I was out to dinner with my wife, and just where the restaurant was, at the walkways through the village in Whistler are quite populated, if you will. I asked my wife to count the number of people who took one step of diversion, not sideways, just an angled step to stay 6 feet away while we were waiting for our food to come, which took about 15, 20 minutes. And we saw 2 people out of hundreds. That was it. Like, you would never, like, if I took a video of a year ago, I doubt, other than every now and again, you'd see a few people with masks and you go, what's up with that? You would never know there was any difference, really. Like, it was like, to, even if they were 4 feet away, just to move so that it would be 6 feet. Like, you know, you're not 6 feet away. You know, you're not far enough. But there was not even an attempt to move by either party. Like, so I was really, when I thought about what you were saying about rebounds and stuff, I'm going, like, it doesn't look like everybody is, I think they're just waiting for somebody to blow a whistle saying the coast is clear, but I don't think that'll happen unless you guys, like, so I said in the program, I mean, it's like driving. I mean, you've got to willingly stay far enough away from the other cars, and we all do it on the road, and we don't have a problem with it. We do have a problem with the people who drive too close to us, and we somewhat, let them know, sometimes nicely, sometimes not, but it's not socially accepted. This did not look like it was even noticed. And I'm going, well, that does not bode well for a rebound. Anyhow, what about your neck of the woods? Texas is, I think, getting better, David. But how is it? How is it around the metropolitan Dallas area? And then, what you know about Texas, if you could. And also, just you're all over the world as well too. So, and anything else that's come up in the last 3 weeks that's newsworthy? Go ahead.
Well, actually, what we've noticed in Texas is luckily from 3 weeks ago, we really had a bad burn, as Anthony called it. We definitely were heading to cases where hospitalizations were overflowing. They were actually setting up a temporary morgues outside of hospitals in Houston. So it got quite extreme. That fortunately has lessened. It hasn't gone away. A lot of two areas of, I guess, hotspots, so to speak, are toward the border cities in those type of areas. Corpus, El Paso, Houston, some of those are hit hardest. Dallas was hit hardest, but again, there's a lot of people who traverse through Dallas to get to other locations. And so as a whole, I read an article yesterday, actually, the prison system here has gotten hit very hard as well. Because we haven't released as many as some states have in terms of trying to mitigate those folks catching it. and people from the outside, the guards and the staff and whatever, some of those cities have been hit a little harder too because of that cross-pollination of the virus that has been come across through the prison system. Those guys don't have a lot of protection and ability to distance. Obviously, their mobility is constrained, but they aren't always able to keep 6 feet apart of other people, I think. So those are really the areas in terms of that. Now, within Epiroc as a company, we put in a required mask policy at our locations in Texas about 5 weeks ago. Maybe it's 6 now, late June. And the compliance to that has really grown quite a bit in the past 3 weeks. We were really, it was a habit that had to be formed. We had to basically say that there were different methods of coverage you could have. Gaiters that came up from your neck, or even face shields are allowed for some people that have allergies and things that don't allow them to wear face covering that is more direct. So I was in yesterday to the office, and I mentioned at the compliance, I didn't see anybody who wasn't compliant. So those are good norms, and we're seeing better results in some of our neighboring South America countries. They're coming down in number of cases, which is good. Sweden, the death rate is near 0 now. They took a big hit early on. We're going to see in retrospect whether their approach, at the end of the year, looking at the total summation, we'll see if that approach had its merit. So overall, I'd say things are calming down, reducing, and people's ability to kind of realize we have to deal with this for a while has settled in a lot in the last 4 weeks, I'd say.
Yeah, sorry, I should have mentioned this, everybody. Head office for Epiroc is in Sweden. David and I both, well, he's been there obviously a lot more than I have. I've been there once.
In January, yeah.
The first person that I knew personally is one of our consultants for Sweden. He and his wife both got COVID, and they live with his 102-year-old mother, who also got COVID, and all of them survived. But he said it was one of the most wicked flu colds he's ever had. It was nothing. And my brother-in-law thinks he got it as well too. He and the 5 guys, 5 out of the 12 at their construction company, but they just got told to go home, and if it got worse, go to the hospital, and they all got better. So there'll probably be 5 people who got it and are never got it, got better, never recorded. Ed, what about Florida? How's it going? How's it going in Florida in terms of COVID and the public and the workplaces as well too, Ed, if you could.
Yeah, before I say anything, I want to put a shout out to Alex Masadi. Just pinged me and said, "Smile, Ed, you're on camera." So, no, really, Florida is still the data. Finding good data is still tough. So if you go online and you start Googling the case rate, they're showing us that we're down to 4,000 cases a day. But if you look at other networks, they're saying that we're consistently below 10,000 infection or confirmed infection cases per day. So there's still quite a big delta on the accuracy of that. But we do know that it's all over the news that we just hit a little over 10,000 deaths, and we're sitting at 588. They're saying 600,000 confirmed cases in the next 2 to 3 weeks. So some data says it's trending down, and other data says we're not seeing much improvement. So I'm just going to share with you what I'm observing, and while I'm out in the community, I'm observing. You hardly see anybody in a Walmart without a mask on. So that's being controlled very, very, very good. Obviously Costco, but places that you didn't, that typically traditionally wouldn't put a good push on masks, you're starting to see people in those places of business that are, really doing a good job practicing social distancing. So it's very rare to see somebody not have a face covering when we're out in public, or if they get out of the car and they're walking without a face covering, as soon as they walk up on somebody, they put a face covering on. And then to add to that, I got a unique story. As we talked about last week, I sold my house and we were moving. So as you're moving your house, you start to accumulate a lot of trash, right? So the trash ran on Tuesday. So I filled the trash barrel, and I had about 5 bags of trash sitting up against the trash barrel. And as the trash truck was making its round through the neighborhood, I stood out by the barrel so that when the trash service emptied the barrel, I would dump more trash in it. And I'd keep doing that until we got rid of all the trash. The point of the story is when the gentleman in the trash truck pulled up to the barrel, he had reached up behind him and pulled his face covering off and put his face covering on, even though he was in the truck. His window was down, but we were good 8 feet apart, and I'm standing there, but he put his face covering on before he stopped the vehicle to empty the trash, because I was standing outside with my face covering on. So I put everything in the trash. He dumped it in the truck, and then I watched him as he pulled away. And it wasn't until he got to the next house that he took his face covering off, hung it back up on his window or on his mirror. So those are the things we're seeing now in public, which is much different than a month ago. A month ago, I think we're to hit 15,000 confirmed cases a day for a few days. So just that observation of the trash guy putting his face covering on while he was in his truck before he got to his stop was huge. So that's a big difference that we're noticing in public, and we kind of make it a game as a family to try to find people now that are not wearing face covering, and then observe how people react to them. And you'll see people walk completely out of the way like they're diseased, unfortunately, when they're walking down the sidewalk. So there's a few people that give you that dirty look, I'm not going to wear my face cover. But on the most part, to David's point, it's becoming more of an accepted policy, and it's being enforced a lot more by businesses. And when the businesses start enforcing it, guess what? People just naturally start to do the right thing. And I think that's starting to affect the reason why our cases are now starting to slowly come down, and we're seeing less infections each day in the state of Florida. So those are my observation at this point.
Well, thank you. Thank you. I mean, interesting though, very different from what I was saying is what you see up here. Although, this has been a very, very low case rate province. And once you get outside of the metropolitan areas, again, very, very, very low risk, but also very low protection too. Like you don't hardly see anybody except for the people like at the restaurants wearing the matching face masks to the uniform for the hostess, so that it's all color coordinated now, right? But it's much different because the risk here is different. But I also think the people have got to get with it too. But it sounds like at least where it is more serious, the people are taking it more seriously. So that's encouraging. If I can, let me, the idea as we move into zero harm from COVID, everybody, and then it's sort of connected, obviously, it just makes zero harm even that much more difficult, a goal, which again begets the argument of, should you have a goal like zero harm that may or may not ever be achieved, and is something like that demotivating because it isn't really an achievable goal. This is a subject that I have very definitive opinions on. So I've made a number of notes here, which is just shut up, Larry, and let them talk, because this is about them. But this isn't a subject that is near and dear to my heart. But Anthony, you folks have zero harm as part of your mission statement. Maybe if you could, I don't think, you solely were the originator or driver of this, but maybe if you could, Anthony, just a bit of the background. When and where did this originate with P&G? Was it with the whole company? Was it with a division that started it? And do you know why the decision was made? Any of the background of that, Anthony, and then as you know, I'll go into the next part, you guys, later on, which is, how's it all working for you? But when did it all start, or how? Do you know, Anthony? Are you on mute?
On mute. That happens a lot on these calls, so apologize. Yeah,
No.
this gets traced back to its origins in the 1970s, and I think as a fast-moving consumer goods company, it's always been recognized that there's kind of a nexus between safety of our employees, safety of the communities in which we operate, and the consumer's best interest and their confidence in our products. So that's really been founded. So there's zero harm transcends, product safety, consumer safety, our environmental safety, and frankly, our worker safety. So I think that traces its origins back to the late 1970s and early 80s, and that's been part of our health and safety policy since then. And if I go back a little further and I think about the triggering event for that, really comes out of our detergent business. So back in the late 60s, detergent enzymes, which are respiratory sensitizers, were introduced across the industry. And there was soon an outbreak of occupational asthma and severe asthma in people. And this year is actually the 50th year that we mark our safety program for preventing allergy in employees in that business. And I went back and looked at some videos, and I found business leaders who really made that connection about the interest of our workers, the interest of our assets and protecting our operational assets and protecting our consumers really can't be separated. It builds confidence in our products, it builds confidence in our workers, and it really is about resilience across the supply chain and across the concept. And the way we think about it, at least modernly, and certainly you will find documentation where zero harm or zero incidents and injuries, and the words, was a goal. I think we treat it as a value now, and it really is. I mean, as I bring new people on board or I bring new operations leaders on board, I remind them of those historical connections to product safety and people safety, and we term it human safety across the whole scheme of thing. And so I think we teach it as a value, not a goal. It's an aspiration. It's about safety. It's about stewardship. And it's about sustainability. So that's just how we kind of look at it here. And are we perfect? Absolutely not. We don't achieve zero, but we remind people that our value is to do everything we can to keep that supply chain and our people resilient and safe. And that's played out well in COVID as well. Yes,
well, and I've been in a number of Procter & Gamble plants, and it did, especially the two, Belleville and Brockville, very Canadian, if you will, culture, which is not a raw thing unless it's hockey, and a very realistic, responsible attitude about safety from the people. I would agree. They did, and it is a value. I mean, that you would just leave a bag, grab the handrail, go to the top, walk down, holding the handrail, and grab your other bag and go back up. Just nobody really thought anything of it. Whereas so many places I go to, nobody would even mention it in the first place or even think about it at all, right? Or let alone offer to carry your other bag for you so you could hold the handrail, right? Which happened everywhere. So 1970s, that's that. I didn't know it went back. It went back that far. I should have a look here just to make sure I get this right. But I think so. David, what about Epicor and Epiroc rather? And do you have like you do have zero harm in your mission statement, I believe. And so again, maybe just like Anthony, when, where, how, why, and I said next round of questions we're going to get into how's it working and what are the benefits, but just maybe a bit of the background if you could.
Well, I think Epiroc is, and we were part of Atlas Copco until 2 years ago. So we come from a long lineage and history over 150 years as a company. But as a lot of companies would work towards reducing injuries, zero fatalities, those kinds of aspirations and goals. The safety first moniker is traditionally always what people have. And so one of the changes that has evolved in the last years now is moving toward more of a safety always. And this came about, frankly, through really the implementation of SafeStart that we had in the US, which now is a global implementation. And the reason is, you think about harm, and harm is a little softer term in the sense that it kind of brings about a different emotional connection. Harm toward yourself, harm toward your families, what's going on in the community. All of these things are wrapped into
environment especially, I think, is intuitive.
Yes, exactly. And so we have a dichotomy of our product because we make things that drill holes and make dirt and move things into the air, and we burn diesel. There's a lot of things, and we've moved now to much more electrical products. We moved into much more sophisticated air handling for the consumption of the dust and things so that it doesn't get out into the environment. The plants, of course, have done their part in emissions. So it's really part of the 2030 goals of sustainability. We've brought about zero harm as part of that process and part of that evolution, and some very aggressive goals and objectives to reduce CO2. We have a major program we started now called live work elimination, which is a hazard in the mining industry. It's a huge one. And it isn't just electrical live work, it's also hoses and being in the line of fire. That has now dovetailed very directly into this live work elimination. So really looking at the work content of the people and the things that we know that are harmful to them, but we've not looked at it that way in the past. So it's really an evolution and a better perspective of harm that exists that a lot of times we were blind to because of complacency. And so it's really a different attitude toward it and looking well beyond the surface at the overt things and looking at the things that are just as punishable but often overlooked.
Yes, and I think that certainly in terms of well, I don't know what the right way to put it. Helping your employees, your workforce, get on board with environmental work issues, things, extra permits, precautions, all of those sorts of things that 30, 40 years ago weren't really. They were add-on. They weren't integral to what the company was doing necessarily. Right. And so I think certainly injuries. If you just have it as injury, like we work with a lot of companies that have a zero incidents and injuries sort of mission statement, which is it's close to zero harm, but I don't think it lends itself as well to the environment or to 24/7 as zero harm does, even though it's pretty close to the same sort of a goal in terms of the injuries, right? We're not going to be happy with a certain number of people seriously hurt or a certain number of people killed. Ed, what about What about ABB? I believe ABB also has zero harm in its mission statement. Now, for those of you who aren't ABB, well, all three of these companies are global. Not every country in the world they operate. Well, maybe David's. You do everywhere there's mining they operate. But just about everywhere there's electrical power, ABB operates too, Ed. So, I've never been in a country in the world where you couldn't get Procter and Gamble products, Anthony. So maybe there are some, but so Ed, what about? Is it everywhere with ABB, the zero harm, all divisions across the whole company, or and again, just background, when did it start and why?
No, I started doing some research on that when we had that conversation a couple of weeks ago. And in ABB, looking back, it's surfaced itself many different times and throughout the course of the year, talking about zero harm culture, zero injuries. But I think globally as a standardized front and to the public and to the employees that work in ABB, it wasn't until Michael Cook came and I want to say about 2015, 2016 timeframe and said, hey, we're going to create this zero harm culture and we're going to put some aggressive metrics out there. And at that time, part of our 2020 strategy was to get all of our organizations at a total recordable incident frequency rate at a 0.88 or lower. So that was at a very aggressive metric put out. And in order to get to that metric, you had to really take a look at your culture and all of your leading indicators and contributing factors that would lead to events occurring that created injury for the employees. And in 2018, as ABB globally incident rates were below 1.0, then we put together a group of individuals, managers that were part of a middle manager project, and we started benchmarking some of our leading competitors that had low incident rates as we did, incident rates below 1.0 or less, and then started taking a look at these SIFs, comparing those to our significant injuries and fatalities with these low total recordable incident frequency rates. So as our zero harm culture, as our incident rates became lower than a 1.0 or less across the entire global organizations, what we started noticing is our fatalities and our serious significant injuries started to stay flat. So then we had to kind of shift our thinking a little bit into, okay, we're bringing our medical treatment injuries down, but our fatalities and some of these significant injuries are staying flat. So we had to kind of use that zero harm culture to kind of start to reprogram the mindset of the managers and those that drive culture within ABB moving forward to really start to bring these significant injuries down as well. But
don't get too far ahead of us, Ed. It's the title of an upcoming webinar in the next series, because I think it's a difficult question that's been really been discussed a lot lately. I'm not sure I'm satisfied with a lot of the answers I've heard. The recordable injuries have come down, but the serious injuries and fatalities have not. Why, right? So we'll definitely get into it. But you think zero harm helped? Well, I'll get to the next question. Is it working, Ed? Is it working? But
I would say it's really working, because what we noticed in the past is that if we started encouraging facilities to say, hey, we want to reduce our incident rates by 30%, guess what? They reduce their incident rates by 30%. So the goal is to really start to put names and people to those incident rates. So, last year, let's say we injured 160 employees, right? And that was a 1.1 incident rate. So to reduce it by 30%, we really need to get the focused around, let's create a culture and an environment to where employees can do work safely and where safety just naturally starts to happen. So let's make an aggressive goal to get to zero. And we started seeing a lot of facilities go throughout the year, course of 1 to 2 years, where we didn't have any medical treatment injuries. Now we know that maybe that's not realistic to sustain that long term because business change, people change, the environments change. But it's back to that conversation you and I talked about. The probability of the Cleveland Indians, not the Cleveland Indians, but the Cleveland Browns actually winning the Super Bowl is extremely low.
It was nice. It was nice he didn't
say they go into the. Go ahead. What was that? What's that? Yeah, but.
Ed, I was just gonna say, it's nice he didn't say Cincinnati with Anthony on the line there, right?
But each year, the entire organization puts together a game plan to win the Super Bowl, and the expectation of the organization is to win the Super Bowl, right? And so they hire, they train, they bring athletes, they develop a team to win the Super Bowl. If zero harm culture is ultimately where you want to be, then each year our facilities need to be planning and creating a strategic plan around how do we get to zero? How do we not injure any employees this year? And so shifting that mindset around that, knowing that, okay, if we have an injury, I'm not saying that that's okay, but that's not the end of the world either. It's go back, regroup, try to understand where these barriers failed and what were the leading contributors to those failed barriers, and make correction. But ultimately, we want to create an environment that employees can come to work and safety just naturally starts to happen. And zero is a realistic number that we can go a year at our facilities, not actually injure or send one of our employees to the hospital or have a recordable injury. And we're starting to see some really significant improvements around that thought process of how do we get to zero, and how do we create an environment where that is safe for our children. So, one of the things we put out there, not to talk too long, is, Scott Fulbright, who's no longer with the organization, he's retired, but he said, I challenge you, is our environment, is our manufacturing facility safe enough for your children to come work at and not be at risk to get injured? And when you really think about your children coming and working at the environment, is it safe enough for them? If the answer is yes, then we're doing the right things to create a fatality-free platform or a facility that doesn't allow employees to get injured.
Yeah, I know, Ed, you and I talked about Peter Bamford, who was one of the very first SafeStart consultants who came with us from Grand Trunk Railroad, and he implemented SafeStart after a double fatality. And for those of you who don't know, there's no shortage of rules and regulations in the railroad industry. 724 rules you have to be able to pass a test on or something. But he didn't know what to do, and but he would always do that when he went into a company. Once he started working for us, he'd walk around and he'd go right into the managers, bring them into the room and say whether he would or he wouldn't let my kids work here. And I remember the first P&G plant he went to, Anthony, he said, I'd let them all work here, Larry. Holy smokes. I've been to 2 P&G plants, as I've said, that have worked. One of them was 600 plus employees, a year and a half without a recordable injury. I don't know whether they made it to zero off the job injuries or not there, but I know they've made a huge impact on it. As well as Belleville too. But Anthony is, I know it's working at P&G. Probably some of the lowest injury rates for a big company anywhere in the world that I'm aware of. I'm not gonna, brag about it all, but you must, when you heard Ed say, 0.88, you're probably going, well, that'd be trouble for a few people at this place, because that would mean they'd really gone downhill from where they currently are. But you have 74, 75 operations around the world. Is that correct, Anthony? 150,000 employees, something? Maybe not as many.
Let me correct you on that one. So things have changed since you were probably last in Brockville or Belleville, but we have about 150 manufacturing facilities and about 75,000 manufacturing associates in those facilities. And we have third-party contractors like everyone does. So our total pool or cohort of people who might be at risk from work is probably around 100,000, just to give perspective in our manufacturing facilities. And again, we don't tend to brag out on our TIR, although I will admit if I went to leadership with a 0.88, I'd probably be in big trouble. But the hard part of it, and I think Ed alluded to it well, is how do I maintain and improve on that when you get to a mature safety system, and then you still have these things called SIFs. And we haven't really cracked that nut. We're trying a whole bunch of different things. Now, I will say that we've been able to, I think, be resilient and have some resiliency in our total incidence rate and our contractor incidence rates on plant property, because we have lived that connection. So I think if you go to any site and you talk to people, they will see a connection between their work, between the product quality, their safety at work, process reliability, delivering every case to our consumer. Again, that we use this delight the consumer concept, and that there's a nexus to our community that we operate in, so the surrounding area from an overall EH&S point of view. And then I think there's this bigger connection to society, and I think that was just reinforced through COVID, through our Force for Good program, which I talked about, because everybody could wrap their mind around, I need to produce more toilet paper, I need to produce hand sanitizer, despite that I've also got to keep up with the demand for shampoo or whatever product it is. And I think if you can, again, that helps to bring that value equation together of a seamless set of goals and objectives that wraps around, a value. Again, we struggle, how do we get from 0.29 to 0.27 to 0.2 to 0.1 to 0? That's always going to be there. I think the other focus area though is every now and then, even our best plants on a given day will have a SIF, and we are like, okay, where's the data that told us this was going to happen? And I think that's one of the challenging things for all EH&S professionals. How do you really get a handle on those things that, just don't occur? And there's lots of schools of thought out there, and I won't go into that. But what I do say works for us is I think reminding people on our going injury and incident prevention and illness prevention is really around that, hey, there's an inseparability between my safety at work, the product quality, delighting our consumer, protecting our community, protecting the shareholders' equity, and protecting, society itself, making products that make society better. And I think if you talk to almost anybody at the plant, they'll, especially in the area where we display the products that they make, you'll see a big sense of pride in that connection with most people.
Yeah, you do actually. Although when you say if you walk around one of our plants, when I walk around your plants, people just talk to me like I work there. Like, hi Larry, like as if I'm there. The plant manager even said, do you not notice the way people talk? I said, well, it's really cool. Yeah, I said, but that sort of acceptance, that acceptance that it is a 24/7 thing as well. David, let me ask you folks at Epiroc, I've also seen it working at your place in Garland too. I think it was the first place I've ever been to where somebody was asking me for an autograph, and I practiced my signature a lot in Hollywood, you guys, but never actually got ever asked. So it was kind of a thing. But how's it working for you? How's it working for you folks? Start with your own plant there, or Garland, David, and then just give us how's it working? How's it working around the world, especially maybe a bit with the you guys operate in some cultures where zero zero harm is a long way from what happens to people. The daily risk, all the rest of it that's out there. So yeah,
Yeah,
yeah.
mine's
Just
are,
India, driving in India, for
yeah,
instance, to
yeah,
get to
well,
one of your plants is really quite harrowing. And then to get to your plant, you would never know you were in India once you were in there, other than the people. Like it is, you could eat off the floor. I was amazed.
well, driving in Peru actually scared me the most because I didn't expect it to be so bad, and it was. So you always get a surprise. But you're right. I mean, mining inherently is dangerous, and the work environment, and the mines have very stringent requirements, of training and going into them that our people have to follow. And what's interesting about it is
Yeah, but just a sec, David. For those of
yeah.
you who don't know, I mean, the underground mining it is not a culture that you want to walk into faint of heart, okay? Like any more than you want to go talk to iron workers, hand loggers, oil riggers, or this is a group that if you haven't been underground, then you should probably keep your mouth shut. That's their opinion. I mean, it's a tough group. I was Now, if they like your stuff, then they like your stuff, but I wouldn't want to be
Right.
there. I wouldn't want to be there if they didn't, quite frankly.
Yeah.
So
Yeah, it's a
just
different world. It's a different world too when you go down there, even physiologically.
yeah,
It's
so
yeah, right.
yeah,
So it's very different. But my observation has been, ironically enough, that sometimes the amount of over the top efforts they make can drive complacency. And so you get a false sense of security in some ways and other things. And I think that has borne out in some cases we've seen of injuries that have occurred when people aren't looking at the more mundane, I guess, aspects of things that put them in harm's way. And so that really is starting to become more of an evident thing regarding applying principles of SafeStart, frankly, to these work environments and looking. There are work environments that drive fatigue, for example. So not only are people fatigued generally, it's kind of built into the process. So one of the things in looking at things like risk assessments, which should hopefully help you reduce your chance of injury, is looking for drivers of states. What activities create drivers of frustration or drivers of fatigue or things of that nature that inherently, if modified in some way, could provide a much more harmless work scenario. And the guys who do that every day, they know those things. They live those things. And they will tell you, but the problem is nobody has ever asked before. Nobody has ever.
Ed did.
Ed did, okay.
No, that's well. I don't want. I want to ask Ed a different question, but that Ed actually did implement a whole go out and tell me, not tell me, but tell the folks
Yeah,
what's
sure.
causing frustration, and then they
Right.
actually set about getting those things. You can't fix everything immediately, but
No,
they did actually have they made it. Like, you're right, they won't tell. The people don't want to complain and on whatever. You go out and ask them, say, tell me what frustrates you in this job, then they will tell you, especially if they think that you'll get rid of it, right? If there's no point in telling you, then they might not. But if you go out and do something about it, for sure they'll tell you. I used to
yeah,
say that all the time. I said, if you wait for people to make a suggestion and put it in the box, I said they will, but typically there'll be a fair bit of pain associated before they do it. If you go out and ask for suggestions, door to door, hey, is there anything we might be able to do to even just make this job easier or more efficient, let alone safer? You'll usually get lots of suggestions from people, right?
yeah.
Um, yeah, well, especially with me too, because they think, I might be able to talk to the manager and actually get it done. But um, But anyhow, Ed, let me get to, before we run out of time here. I wanted to ask you, because you and I talked about, well, this for so long, you know, different academics and their positions on zero harm, and you know, me saying, of course, you know, get, like I said to Michael Cook, it's fine, but you know, if you don't have to live with it, makes it a lot easier to pontificate. That's for sure. But one of the things that you said to me, Ed, that just, I don't know, really resonated with me was that if you wanted employees to take safety home, you wanted them to think, you know, that driving safety was really important, because it is. That was almost an impossible message or communication challenge if your goal was a 30% decrease in recordable workplace injuries. That, you know, to bridge from there to, and we want you to really think about your own safety as you're leaving the plant, driving home, because that's where you're likely at the most risk in the last 24 hours. To get from a 30% decrease in workplace injuries to that was just, it was just too much of a leap. So how has zero harm been working for you guys in this? Or, you know, if you want to just sort of talk about that a bit, and then I'm going to get Anthony and David to just comment on that a bit, and then we got to wrap it up, I think. But I can't remember what you said when we were talking before, Ed, but right along those lines, if you could, because I thought it was really.
So just real quick, as your incident rates get below 1.0 or less, the signals that you rely on to get those incident rates low, those signals really start to change. And so you have to look at these signals in a different way, right? Or you have to look at different types of signals that you normally wouldn't focus on to continue to drive your incident rates lower. When it comes to the employees, ABB has really started to focus in the safety world around change management. We use the ProSide change management model. And in order to get somebody to do something different, they have to have the desire to change. And in order for them to change, you have to answer what's in it for them, right? Not why you want them to change or why the business wants them to change. You have to answer that fundamental question to that individual employee. Why is this important to you? And how is it going to help you and your family be safe? Or how is it going to help you and your family be prosperous moving forward? And you're going to have resistors along the way, and you have to learn how to manage those resistors. So one of the things that Alex Masadi is actually on this call and bringing SafeStart into ABB was that first time that we actually had a program, a behavioral-based safety program that says, hey, you know, safety at work is important, but safety at home is really where it happens, right? And so getting ABB and getting that mindset to change from the total focus on work to the family and the community and those around you was really a great eye-opening experience for ABB. And then to be able to work with those individuals around change management on how do I answer that, what's in it for me? And if we can answer those questions, you know, let's start to actually resolve those frustrations or resolve the things causing them to be fatigued, resolve the things that are causing them to rush. Those are important to the employees. So as we start to really focus on the things that are important to the employees, we start to create that desire internally for them to do things differently. And those things just naturally start to be taken home to the family and the community and the SafeStart stores. And all those start to become building blocks to drive this change. And that's what started to really help get our incident rates lower and to a manageable level to where we can really start to get into the details behind, okay, the injuries that we are still happening, we have to really get into the details and the fundamentals about what are the things behind the scenes that are causing those injuries to occur. Those are those latent conditions that lie dormant within the organization, and stop focusing on people, but actually start focusing on all the contributing factors that lead to these injuries. And really quickly, I hope that answers your question, but
Did it
have
help?
to focus on the desire piece of that, the desire to change.
I know, Ed, I agree with that totally. Like that, you know, that what's in it for, I mean, so much of why I tell people, look, you can spend all your life you want trying to scare grown men into being safer. These are the same people that went to war for you. So it's not going to work, okay?
Right.
And even if you make it work, it's not going to work for very long because that's not the way your brain works. We've all seen grisly accidents on the highway. How long
Right.
did it take before everybody was driving back to normal? Like a minute or two, right? So, you know, and that was when you saw it with your own eyes, right? So you're not going to scare grown people into working safely. But I used to say this all the time. If I was with hand loggers or oil riggers or whatever, where it was rough and tumble, and I'd say, how many of you men here worry like me that your kids will turn out to be just like you? And you would see these guys go, oh God, yeah, Jesus, boy, no, 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 you know, because, and you know why, you know how lucky you were, and you know that that's not the plan that you want for your kids, right? Try to be as lucky as me. But is it working, Ed? Has it helped you in terms of improving whatever you want to call it, traction with off the job safety, with driving safety? Do you think having
Yeah.
zero?
I would say yes, 100%. You know, we've deployed SafeStart in 30 manufacturing facilities, and it's not us go out push SafeStart. It's more of a request. We have another facility that is looking to launch SafeStart. It's part of our GE Industrial business that we acquired, and it's them reaching out to us and saying, hey, we're raising our hand. We think SafeStart, you know, we've seen how it's affected other businesses. We've seen how it's affected incident rates. We've seen how you used it to drive quality, productivity, and on-time performance. And so, you know, it's really starting to make a difference. And I think it's a valuable tool to use to get to that zero harm culture. And Larry, like you and I talked about, I shared that article with you. You know, we have a facility that was a runner-up for the CEO award, and if you go back and you ask them, hey, what were the big contributing factors to leading to a zero harm culture or a very, very low incident rate, SafeStart and having that behavioral-based safety, it was a key contributing factor, because not only was it about the employees at work, but it was about the children, it was about the families, it was about the church, the community, and all of those things that influence our employees that work for us as well. So to answer your question, yes, very much so, has made a big difference.
I mean, for me, the first time I heard that twice as many kids die as workers every year was huge for me. Like I was going, well, jeepers. I mean, what am I doing? Like, why am I not, get this into schools for heaven's sakes, Larry, although it's actually been one of the things my dad he's 90 years old, Anthony, he says to me all the time, so you're going to help P&G get from point 2 to point 1, Larry, or you're going to go to Africa where the people are dying every day. So he's also been very adamant about what P&G's provided for us too, in terms of the quality production aspects of all of this as well. But has it been working for you folks in terms of 24/7 safety, having zero harm in your mission statement, Anthony? I know it's not like you've got hard data for this, but would you guys in the corporate EH&S department, would you say that that's been a help in terms of, because you guys have done it like right even into the community. I see the safety kind of percolating through the community, if you will, as well too. So is it having it in your mission statement, do you think, especially for what's 50 years now, Anthony, does it work? Like I don't want you to be recommending anything to anybody, because our whole premise here is this is what we do. If you like it, fine. If you don't, well, that's fine too. But would you say it's been a help in terms of off the job and driving and the 24/7? You're on mute.
On mute again. Sorry about that. So, we don't collect data on off the job. Certainly we do off the job interventions with people, reminding them of their risks. And again, part of every shift change is our daily direction setting and daily management system kind of transfer the house to the next team. And I think so when you enter, you talk safety first, and when you exit, you talk safety last. And I think that helps. And again, you know, we've done a lot of outreach with the families. We have the family days, and if you enter almost any of our plants, you'll see these, you know, pictures of beautiful kids of P&Gers in their safety equipment and mom and dad's safety equipment, reminding them to wear their hard hat, their respirator, their gloves. And, you know, again, we try to, you know, put safety in the hearts and minds of people no matter where they are. So I think all those things, vigilance, you know, eyes on task, mind on task, all those things play into the 24/7 mentality. Again, we don't track it, but I think if you took a look at what we know about what happens in terms of off the job, I think you would say that, you know, in many ways, people are as safe at home that work at P&G, at least where they can influence it as they are in the workplace. I think the biggest challenge moving forward for us right now, given COVID, is how do we, you know, we've driven complacency out in our COVID protocols in our facilities that are operating. How do we, as we bring people back, not have them sour that culture, those people who haven't been, you know, working in facilities and drive out complacency and you know, one of the big things that we're working on right now is community protocols. So how do I know my community's putting me at risk? How do I select where I go and where I don't go? Because I think it helps people put it into perspective about where their risk sits in the community with regard to COVID. And so we've been working on several outreach programs about community threat assessment and how to behave and actually be a good safety steward when you're out in the community as it relates to COVID, by wearing your mask, by doing the other things and modeling that behavior.
So, in other words, if you are a pharmacist, for instance, don't wear the mask on your chin because it doesn't set a good example, right? Yeah.
Exactly.
Like I said, we're a ways to go up here in the Great White North, Anthony, at least on the West Coast, that's for sure. And David, let me just sort of and if I could with you in terms of the zero harm. Have you felt it as a benefit for both the environment and for 24/7 safety in terms of, you know, your operation globally?
I think what we've seen is the initiatives coming out of the group, meaning corporate, have revolved around that. So the efforts and the focus is in those areas. We have a program for getting a 50% CO2 reduction from our facilities by 2030. So there's a major energy program that's going. We obviously have the global SafeStart going. So the workers and the employees see that the focus and the drive here is around those things. It isn't, it's part of business now. It's part of what you need to do to be in business now, because that is really a norm, a global norm, an expected norm that is just as valuable as the products you have. And they've all got to kind of blend together into a company and to products that have that focus. So I think for us, it's something that is, I say newer only in the sense that it's gotten a much elevated visibility and focus from our CEO. And we've always been worried about the environment and sustainable, but now there are some efforts that clearly are prioritized among our companies to provide that as part of who we are as a company. And I think that's really the big difference going forward.
Yeah, okay. Well, first of all, gentlemen, thank you all very, very much for your time in this. And like I said, I'll try not to be too long with this, but my personal opinion on this whole zero harm thing is that it was I've been in this business now for 35 years. Started when I was 12. No, but getting safe to be looked at as a KPI was not something that happened 35 years ago per se. Like, it was not managed the way other things in business were managed. And there was a big struggle to get management to manage safety the way they managed everything else, with the same people, that, not the leadership. It wasn't some offshoot of people that were, to manage safety. It was part of the line function. So that was an improvement. But to treat safety as if it is an equal KPI to production or to quality isn't, in my opinion, fair. And I'm just going to quote one of the first people who sort of took me, I don't know, whatever you will, under his wing, under his arm, and suggested to the DuPont people that they give me a shot. But his name was Milt May. He was the plant manager of the hydrogen peroxide plant at DuPont in Maitland. It's just not too far from your plant in Brockville, Anthony. And he said, Larry, you can have a bad first quarter, but you hunker down, maybe even pull some business in over the summer. He said, you might be able to pull things out by the end of the fourth quarter and recover. He said, if somebody loses a hand, or if somebody loses an eye, or if somebody loses a life, you can't recover. And so what I tell our folks is, you can't treat these numbers as if they were the same as the other numbers, because defective product isn't the same as a defective person. So I think it was very important to start trying to manage safety the same way, but I think to have KPIs where you accept a certain, like, as you and I talked about, Ed, like, we had a 60% decrease in fatalities. We went from 5 to 2, is not cause for celebration. But I think a 60% improvement in production efficiency is. But I just think, the goal of 0 when you're dealing with people is a much better goal, regardless of whether it's an achievement that you'll ever get to or not, right? You can find other ways to fairly remunerate people. So anyhow, that's my 2 cents worth on the subject, everybody. I told you I wouldn't go on for too long. If you would like me to, some of you know me well enough to know I can go on for hours about it, but I won't. On September the 10th, we're going to do the final in the series here, which is on felt leadership. And I guess the question is, do your employees actually feel it? These are definitely easy things for me to ascertain when I get to walk the plant floor at both Epiroc, Procter & Gamble, and at ABB. I've walked the floor, talked to hundreds and hundreds of people, and I can tell whether or not they feel the caring, whether it's token. But I hope you can all join us. It is at same time, 1 p.m. Eastern. It'll be on September the 10th, and the title is Felt Leadership. Hopefully David, Anthony, and Ed can join us. Jessica from Cargill has just had the most difficult time in terms of being able to get online with us. So we may or may not, I don't know if John McGilvery can join us again for that one. But hopefully you can all join us for that as well. And Ed's also sort of preluded, so did Anthony. We're going to get into the, I might even change the order up for the next series, but that is definitely one of the questions, which is about the SIFs, right? We've got the recordable injuries down, even some of the repetitive stress injuries we've got down, even with older workers. But the serious injuries and fatalities have sort of remained at a pretty steady level in Europe, North America, and a lot of other places. And I think everybody wants to know why. I'm not expecting you guys have all the answers. I think I've got some, but maybe between all of us, we can provide some perspective for people on that's valuable as well. Anyhow, thank you all very much, everybody, and we will see you same time, same bat channel, September 10th. You got to be pretty old to remember that. Adam Warren, the old Batman, or I can't
Yep.
even remember if I got their names right now.
Adam West.
Burt
Burt
Ward.
Ward. Burt
Yeah,
Ward.
yeah, Dave. Well, thank you, David. Okay, anyhow, we'll see you all September 10th. Thanks a lot, you guys.
Bye,
Bye-bye.
everybody.
Take care. Bye-bye.